You've decided to get the gastric bypass surgery, and by now, you're probably a little excited and a little nervous, especially if you've never had surgery before. The following slides are designed to help you get through the process pre- and post-op without a hitch. WBI has a comprehensive program geared to get you safely through the surgical process. Our preoperative requirements include an informational seminar. After that, you get to meet your surgeon and discuss what is best for you. A Steps to Success class is given at the start of the process to give you tips on changes that you will need to make to be successful postoperatively. We include a dietary consult as well as a psychological evaluation, and we do pull in other specialists as needed. We want this process to go smoothly for you. Your surgical scheduler will set up your pre-admission appointment for you. You need to make arrangements to have some final lab work and testing done, and this is to be completed somewhere in the 7 to 28 days before your surgery is scheduled. These final little tests will be checks and balances to make sure that your lab work is in normal or acceptable ranges to make your surgery safe. You may hear from us if you have any abnormalities, for instance, with your electrolytes. Oftentimes, patients who are taking blood pressure medicine may experience drops in their potassium. If this is the case, you will receive a phone call and we will instruct you on how to correct this. Most patients need an EKG and a chest X-ray prior to surgery. All of this will be done on the same day, and once again, it needs to be done in the window 7 to 28 days before your procedure. At this appointment, please bring a list of current medications. This helps everyone be on the same page as far as what medications you are taking, so please include over-the-counter medications and any nutritional supplements. It is important that you stop all herbal products and appetite-suppressing products, as well as alcohol, 2 weeks prior to your procedure. Your surgeon will discuss stopping blood-thinning products with you, and these should be discontinued somewhere 5 to 10 days before your procedure, depending on the medication. This includes daily aspirin and non-steroidal anti-inflammatory drugs such as ibuprofen, Advil, Aleve. Other products which are prescription include Coumadin, warfarin, Plavix, and these all have different time frames when they need to be discontinued. Plavix, which reduces platelet count, must be stopped 10 days before your procedure to avoid excess bleeding on the day of surgery. Continue to take all other routine medications, such as antihypertensives, for your blood pressure, your diabetic medications, and especially antidepressants. Do not ever stop these medications suddenly, as you could experience adverse effects. Postoperatively, as you lose weight, oftentimes you can expect to change some of your daily medications. Please check with your primary care physician prior to discontinuing anything. It's a good idea prior to surgery to look at your pills and figure out which ones are larger than a Tic Tac and determine if they can be crushed or broken for easier post-op swallowing. It's important that you do not crush time-released pills or capsules. If you have questions on this, I would suggest asking your pharmacist for guidance. At your final pre-op appointment, you'll meet with your surgeon. You'll get to ask final questions, check your weight loss progress from your liquid diet, review current medications, and you will receive a prescription for post-op pain medication at this time. Please do not take this medication before surgery. It is intended for post-op use only. The staff at WBI will also e-prescribe medications to your pharmacy, so don't be surprised if when you go to drop off your pain medication prescription that there are other medications waiting for you. The day before your surgery, you need to complete a bowel prep. Before you complain, it's not like the bowel prep you may have experienced for a colonoscopy, which involves a gallon of fluid. This is consisting of a simple bottle of magnesium citrate. You open the bottle and drink about 12 ounces of fluid, and you're good to go. But you are on clear liquids after the start of the prep. Clear liquids means anything you can see through, with the exception of alcoholic beverages. It's a good idea to plan on staying home once you begin the prep, and we suggest that you start before noon so that it has time to work its effects and you won't be embarrassed away from home needing a bathroom. Another detail is that you need to remain NPO after midnight the night before your surgery. This means nothing per oral route, or nothing to eat or drink, and this is to keep your stomach empty for the day of your procedure. Be sure to stay well hydrated the day before your procedure. Remove any body piercings and jewelry that you may have on. Fingernail polish and nail art needs to come off, with the exception of clear polish. Pack a few items for the hospital. Don't bring anything of value. Take a shower with antimicrobial soap the evening before your procedure. Try and get a good night's sleep. And you really should be in bed by midnight. But midnight is the cutoff point for drinking fluids. The day of surgery, I will remind you, nothing to eat or drink before your procedure or it will be canceled. We want your stomach empty so that you don't risk aspirating while you're under anesthesia. Take another shower and put on clean, comfortable clothes before leaving for the hospital. Bring a list of your current medications. If you use CPAP or BiPAP for breathing, you need to bring that along. If you use an inhaler, go ahead and pack that, but leave all other home medications at home. Pack or wear a pair of comfortable non-slip shoes that you can walk in after surgery, and leave anything unnecessary at home. Don't bring your laptop and cell phone. It just is something else to keep track of at the hospital. Immediately pre-op, when you get to the hospital, you'll be given a bariatric size gown to put on. A nurse will start your IV. You'll get to meet your anesthesiologist, and if you have any concerns, feel free to discuss them at this time, especially if you're nervous. Let them know. They can give you some medication to help you relax. The anesthesiologist will go over a quick medical history. It's important to share if you have any respiratory problems such as asthma, any cardiac history, diabetes, kidney problems, that sort of thing. The staff will review your medications, and be sure to tell anyone you come in contact with if you have an allergy to any medication. This way, repeating that information will make sure that you are not inadvertently given something that you've had a bad experience with before. You'll get to see your surgeon in the pre-op waiting area. You're going to wake up anywhere from 1.5 to 3 hours later. It may take anywhere between 2 to 5 hours for you to return to your room, so your family can feel free to ask the staff for updates on your progress. The surgeon will look for your family in the patient waiting area. Tell your family to wait in the designated area so that the surgeon can come and find them when he's done with your procedure. Tell your family to feel free to ask the staff for updates. They're used to anxious family members with lots of questions. Immediately post-op, you're going to be in control of your pain. We set up a PCA pump connected to your IV, and you get to push a button when you feel the need for pain medication. It's important that you alone control that pain button, because I have witnessed firsthand well-meaning family clicking when patients have been asleep, and this can lead to oversedation. So tell your family to leave your button alone. It's like the remote on the TV. You get the control. The PCA is set at safe lockout intervals if you are awake to operate the remote. And medication will be determined by your surgeon. And once again, if you have had any adverse reactions to pain medication, do be sure to discuss this with your surgeon before your procedure. We will prescribe medication for nausea, and you can ask the nurses to administer this if you feel the need, but not everyone has nausea post-op, so wait and see how you feel. We will be giving you medication to help heal your pouch, and this will be given through your IV, and post-operatively you will be taking something similar at home, but it will be in a pill form. When you wake up, you will not have a catheter left in place. This is put in during surgery and removed before you wake. We find that it's beneficial to remove the catheter as soon as possible to eliminate the chance of a urinary tract infection, and we also find it a great motivator getting patients out of bed to use the bathroom after surgery. Before you go into the OR, we put all patients in sequential compression devices before surgery, and you will be wearing those during your procedure as well as post-op. The basic reason for this is to reduce the chance of having post-operative blood clots form. These sequential compression devices, or SCDs as we call them, are filled with air to squeeze your legs gently, and this promotes a good venous flow of blood. We'll also give you some medication to thin your blood a little post-op to help reduce the chance of a clot forming. But the most important thing that you can do is to get up and walk after surgery. We get most patients out of bed 1 to 2 hours after their procedure, but keep in mind you will need someone to walk with you. The nurses at the hospital will explain how to use an incentive spirometer. This is to help promote good breathing after surgery. We want you to concentrate on taking nice deep breaths and filling your lungs with air to avoid any post-operative pneumonia or respiratory complications. You may want to think about splinting if you need to cough post-op, and this can be accomplished by holding a pillow or a folded blanket across your abdomen when you need to cough, sneeze, laugh. It'll just give a little gentle support in case you feel a little achy. Another tip that I will offer is to roll to your side when you want to get out of bed. This way you'll be using your oblique muscles rather than the muscles that have been traumatized by surgery. You may just find it's easier to get out of bed this way for the first few days. It's important to keep moving after surgery to prevent blood clots, but another reason we want you up and out of bed is it helps wake up your intestines again. It helps break up the gas bubbles that you may experience after having your abdomen filled with air for the laparoscopic surgery. It helps prevent constipation, and it does really improve your recovery phase. So don't be a couch potato. Get up and move. Usually one day post-op, you will be doing an upper GI swallow study. The purpose for this is to evaluate your stomach pouch. We want to make sure that everything empties easily, and we look at the anastomosis, which is a big word that basically means where we attach the intestine to the bottom of your pouch. You'll swallow gastrographin, which is a water-soluble contrast. Also, before leaving the hospital, you'll be doing a little more blood work, just to make sure everything is good before you go home. Your first meal in the hospital will be clear liquids. This will be sugar-free or no added sugar products. Low sodium broth is another option. You'll be given 2-ounce servings. Keep in mind you should not be having anything carbonated, and you should not use a straw. Straws force you to swallow air, which can be uncomfortable for your pouch. And we also find that you have less control over the sip size. You want to make sure that you sip slowly. Your diet will be advanced when you are tolerating the clear liquids. If you would like to have a visit from one of our Angel volunteers, please let your patient advocate know prior to your surgery. Angels are bariatric patients who wish to offer support to you while you're in the hospital, but it is completely optional, so you don't have to take part in this program if you'd rather not. We like to respect everyone's privacy wishes. It's time to go home somewhere a day or two after surgery. We send you home when you are medically ready. You'll get some discharge paperwork from the nursing staff, things that we have reviewed with the hospital staff. So you'll be hearing things again and again because repetition will make it stick. It'll help you be more successful post-op. Do be aware that this is a life-changing event, so be patient with yourself. It's normal to feel a little apprehensive about going home, and you want to make sure that you allow for rest periods during those first few weeks post-op. You may find that you tire a little more easily than usual. Make sure that you review your instruction sheet from your pre-admission package and the booklet given to you. There's a lot of helpful information in there, but we're going to touch upon the following subjects: pain control, wound care, activity progression, possible nausea and vomiting, bowel changes, and what to do about routine medications. You will be given a prescription at your pre-op appointment with your surgeon for a liquid pain medication. Be sure to get this filled before you leave the hospital. If you've not had surgery before, you may be surprised that you feel a little uncomfortable and achy. This will get better with time. Everyone has different pain tolerances. You may find that during the day you can take plain acetaminophen liquid or Tylenol for minimal pain and the liquid pain medication for nighttime use. Be aware that you should not be taking medications such as aspirin, ibuprofen, Advil, Aleve, naproxen sodium, and Celebrex. All of those are included in the non-steroidal anti-inflammatory drug category, and these can lead to postoperative bleeding. For wound care after surgery, you will be taking a shower 1 day post-op. It's okay to leave steri strips on and the clear operative site dressings, but if you have Band-Aids on, they should be removed prior to showering. Remember to use a clean towel after each shower, and it's important that you do not soak in a bathtub or swim or use a hot tub until all of your incisions are completely healed. Do not put any ointments, lotions, alcohol, peroxide, etc. on your incisions. Please do not pull at the incisions, and you don't have to cover them unless you feel better about putting a Band-Aid over them after bathing. The air actually will help them heal quicker, and if you're not having any drainage, Band-Aids are unnecessary. Please be sure to report any ongoing bleeding. We don't expect bleeding to continue for more than a day or so. Some clear or slightly bloody drainage is normal from an incision, and this is usually in the first day or so. Please report any ongoing bleeding. It is important that you get up and walk frequently. It helps reduce the chance of a blood clot forming. It also does help improve your recovery. Be sure not to do any heavy lifting, so nothing more than 10 to 20 pounds. If you have small children around, have them climb into your lap so you can hold them, but avoid bending and picking small children up. Nausea and vomiting is not usually a long-term problem. Nausea related to anesthesia usually lasts approximately 1 day. Use an anti-nausea medication if needed. It's important to go slowly with your dietary advances, so do be sure to follow the guidelines in your spiral handbook. Take small sips of fluids, no straws or large gulps, because this can promote vomiting. If you drink too quickly, the fluid hits your pouch and it's an automatic reflux. Call the office if you have any persistent issues with nausea and vomiting. Most patients experience bowel changes postoperatively. Early on, many patients complain of loose bowel movements. This can be related to antibiotics given during surgery. If it persists, please call the office. Having multiple watery bowel movements each day is abnormal, and we would need to send you to the lab to have a stool evaluation. Dark bowel movements are to be expected after surgery for the first week or so, and this is due to having blood travel from your newly created pouch through your intestines. So don't be alarmed if you see dark bowel movements, but do notify us if you have any bright red bleeding. Constipation can become an issue as you get further out from surgery, especially if you continue to take pain medications. Be sure to drink plenty of fluid, get up and move, add a soluble fiber such as benefiber to your water each day, and if you need to, feel free to try milk of magnesia or Miralax, which are both over-the-counter medications. Your goal is to have a bowel movement every 1 to 3 days. Waiting longer can create mechanical obstruction and might require a reoperation, so be sure to call the office if you have any concerns. Remember to talk to your primary care physician about routine medications. It's a good idea to plan on several visits in the first few months post-op so that you can discuss dose decreases and maybe even discontinuation of certain medications. And look at your pills. Make sure if they're larger than a Tic Tac that they are okay to crush or cut into smaller pieces for easy swallowing. You don't want to get a pill stuck in your new pouch. You'll also need to take something called a proton pump inhibitor, or a PPI. These include medications such as Prevacid, Protonix, Prilosec, Nexium, the purple pill, omeprazole, and that sort of thing. The PPIs will help heal your stomach pouch, so it is important that you take them after surgery, even though you may not be experiencing gastric reflux or heartburn. Remember not to take pain medications such as nonsteroidal anti-inflammatories, ibuprofen, Advil, Aleve, and that sort of thing. These medications will put you at risk for injuring your new pouch. Be sure to plan for a ride home from the hospital. You will have been taking pain medication, so you cannot drive. And no driving while you're taking pain medication post-op that first week or so. It's a good idea to avoid heavy lifting for about 2 weeks. So that's no more than 10 to 20 pounds. And you can discuss your return to work and exercise plans with your physician at your post-op appointment. If you have any questions, feel free to call us. The best daytime phone number is 775-789-9180, and this will get you in touch with a clinical staff. Do not call your patient advocate with medical questions, please. After hours, we have an answering service, and that number is 775-323-7500, but this is reserved for emergency questions only. Please do not email the staff with medical questions because this can lead to a delay in getting an answer to you. Please call if you have any of the following concerns: an elevated temperature above 101.5, night sweats, unrelated to menopausal conditions, redness and warmth at your incisions, thick yellow or green discharge from any incision, continued bloody drainage, or increased or uncontrolled pain. Go to the ER if you have any of the following: sudden and unexplained shortness of breath, chest pain, leg pain and swelling, and usually it's just one-sided leg pain. You may even notice a red streaking going up your leg. This is concerning for a blood clot. If you have a feeling of doom, this requires immediate evaluation. This is something that is linked with having a leak from your pouch. And although it does not happen frequently, it needs to be assessed right away. Now we're going to review some possible long-term experiences. I want to stress the word possible. Not everyone has all of these symptoms after surgery, but I want you to be prepared if any of them occur. Vomiting. Although it's not very common, your gastric outlet will be swollen for several weeks, so you need to go slowly with your dietary advancement. Don't push your pouch beyond its limits. Remember to stick with clear liquids for the first 18 hours or so, and then advance to full liquids when you're feeling able to tolerate them. When you're advanced to solid foods, you need to be sure to chew thoroughly. There will be no drinking at meals once you are on solids. And if you do have any persistent issues with food sticking or vomiting, please call the office to arrange for an appointment. Some patients experience occasional nausea early after surgery. You will have medication available to treat this if it should be a problem. Remember to sip fluids slowly and stay hydrated. After the initial post-op period, if you have any new onset of nausea that is persistent, you should discuss this with your provider, as it could be a symptom of a health issue, such as a vitamin deficiency. Frothing is something that some patients experience, perhaps 5% of our patient population. It is not the froth that you think about with Starbucks. It is a foamy mucus production that is the result of gastric outlet swelling early after surgery. We know that we can reduce this annoyance by sipping warm water or tea about 30 minutes before your meal. If frothing is something that does occur and persist, please talk to your healthcare provider about it. Stomal stenosis is a big set of words for scar tissue at your outlet. So at the bottom of your pouch, your body may form excess scar tissue. This happens in about 5% of our cases. It usually results in persistent food sticking and vomiting. This can easily be corrected by an EGD procedure with a balloon dilation. So if you have continued vomiting, you need to call the office and have an appointment to evaluate. Dumping syndrome, you may have already read about online. It's the body's response to food passing too quickly from your new stomach pouch into the small intestines. It is usually the result of consuming sugars and highly concentrated sweets and fats. So an example of something that would cause dumping is chocolate, baby back ribs, ice cream, and alcohol can sometimes trigger this. Symptoms of dumping include nausea, chills, abdominal cramping, profuse sweating, weakness, faintness, a very rapid heart rate, and usually ends with a trip to the bathroom and diarrhea. So to stay away from this unpleasant symptom, I would watch the fat and sugar contents in your foods and eat clean. Some patients experience food intolerances after surgery. You have a heightened sense of taste. Some foods that were previously your favorites may not set well with you after surgery, so it's suggested to try new foods in very small amounts at home. Think about a baby. When we start feeding a baby, we introduce foods gradually. You have a brand new stomach pouch, and you need to treat it like a newborn stomach. Go gently, and you can avoid unpleasant food intolerances. Many patients worry about hair loss. Undergoing surgery is a big deal. It puts your body at stress, and then reducing caloric intake dramatically can put your body at further stress. So be sure to strive towards those 65 grams of protein a day and take your vitamins starting 1 week post-op. Getting adequate protein and vitamins can minimize the hair loss. This usually resolves by about 6 to 9 months post-operatively. If you have concerns about hair shedding, talk to your healthcare practitioner about ideas to combat this. There are other options, such as additional supplements and special shampoos. Please report any problems with acid reflux or pain in your pouch. Usually, the use of a proton pump inhibitor such as Prevacid or omeprazole will eliminate this problem. You should take the PPI for the first few months post-operatively, regardless of having any acid reflux complaints. The PPI will help heal your stomach pouch. Remember to avoid taking medications in the NSAID class, the nonsteroidal anti-inflammatories such as ibuprofen, Motrin, Aleve. Many arthritis medications contain an NSAID, so if you have questions on this, talk to your physician. Gas may be a problem post-operatively. As your pouch heals, you may find that you are more sensitive to certain foods, such as broccoli. Be sure to keep something like Gas-X or simethicone containing products on hand. Walk if you have gas pains. This will help dissipate the bubbles. Keep a food journal to help determine if any particular foods are problematic, because some patients do develop lactose intolerance after surgery. I would really encourage you to consider taking a pre- and probiotic after surgery. The literature supports better gut flora with taking these products, better absorption of some vitamins, and the elimination of uncomfortable gas. If you have any questions on prebiotic and probiotic use, talk to your provider and they can help figure out what is best for you. Follow-up care is extremely important. You've committed to lifestyle changes with this surgery, and the first year we want to see a lot of you. You will come in to see your surgeon 1 to 2 weeks after your procedure, then again somewhere 4 to 6 weeks post-op. At this appointment, you will be given a lab slip. Lab work is essential for the 3, 6, 9, and 12-month visit. Please attempt to follow this schedule because it will help keep you on a healthy path. During the office visits, we will discuss your protein intake, fluid intake, physical activities, your weight loss, and do expect to experience some weight loss plateaus. It's perfectly normal. We look at your comorbidities, those issues that brought you to the decision of having surgery, and we hope that a lot of these are resolving. We review current medications, look at recent lab work. We want to know how you're doing in general and if you have any problems or questions. It's important when you come in for your initial post-op visit to ask about your pre-op vitamin D level. Many patients are low in vitamin D, and we will be able to give you guidelines on dosing at this time. Please maintain contact with your primary care physician, the person who supported you to get you through surgery. That care provider will be the one to adjust your routine medications, and that person will be the one you call for any medically based problems. Western Bariatric is here for your surgical follow-up. As a reminder before moving on to the food part of this class, remember you need to take your proton pump inhibitor for at least 1 month, but up to 3 months postoperatively. Your surgeon will help you decide on the length of time. Remember that bariatric surgery is just a tool for weight loss. Your success is very dependent on your commitment to lifestyle changes and medical follow-up. Support is necessary to help you reach these goals. So don't be afraid to reach out to office staff if you feel you need some encouragement. Don't forget to celebrate the milestones in your journey. It may not just be the number on the scale. It may be that you can finally travel on an airplane or tie your shoes. And also keep in mind, if you become pregnant after surgery, schedule an appointment to discuss the plan of care with your provider.
Now we're going to talk about what to eat and drink after surgery. When you come in to see your surgeon for your preoperative appointment, you'll receive a packet. And in that packet, you'll have a handbook that will have the diet progression in there. It's also a troubleshooting guide for you after surgery. Be sure to read this packet through several times before surgery and refer to it after surgery as well. One of the problems that can happen right after surgery is dehydration. The goal is to have you drinking 64 fluid ounces a day, but it might take you a while to get up to that. Your first few weeks out from surgery, work on getting 32 to 45 fluid ounces in a day. One of the best ways to check to make sure you're hydrated is when you go to the bathroom, just check your urine. Should be clear or pale yellow. If it's starting to get darker yellow, you need to start pushing those fluids. Remember, with this surgery, there's no beverages with your meals and to wait at least 30 minutes after you're done eating before you start drinking beverages again. Please remember not to use a straw. That straw is filled with air, and when you suck on the straw, you're going to fill your pouch with that air bubble, and it's uncomfortable. The other thing is stay away from the carbonation. Those are gas bubbles. They expand in that pouch, create pressure and discomfort. You can also use these to count for your fluids. Broth, any of the 0 to low-calorie beverages that are non-carbonated, you can use those. Your shakes will also count towards your fluid. And I recommend that you continue with a shake 1 to 2 times a day after surgery. This time you're going to want to make it with 1 scoop of the shake mix instead of 2 because your portion sizes need to be smaller. If you make a 1-scoop shake, it'll probably take you about 30 minutes to drink it. I want to mention a word about coffee. Coffee has acid in it, and even decaffeinated coffee has this acid in it. And initially, right after surgery, it can be a pouch irritant. So if you drink coffee, even decaffeinated, it might not set well in there, and you might feel kind of yucky. If you have this, go on to drinking some tea, and in a few weeks, you can go back to trying the coffee again. And a word about alcohol. We talked about this in STEPS class as well. It is not a good combination with this surgery because your body does not process, absorb, or metabolize alcohol like it does before surgery. When you get discharged from the hospital, you're going to be on a full liquid diet. You're going to want to follow the diet progression as it's written in your handbook to prevent problems. There is a reason that we have you go through this diet progression, and you do have to let that pouch heal. So your first week, you will be on full liquids. This is described as food that pours off of a spoon, no lumps and no bumps. We don't want any problems with food getting stuck in there. The portion sizes listed in your handbook are a guide to be used to help you figure out about how much you can put in your pouch because it's going to take you some time to figure out where your full point is. Remember to eat 5 to 6 times a day because you want to keep your blood sugar stable. When you reach week 2 after surgery, you are progressing to smooth foods, otherwise called pureed foods. And these are foods that are the consistency of like pudding or yogurt. No lumps and bumps, but they kind of just sit there on the plate. Please don't use baby food. 1, it doesn't have any taste, and 2, it doesn't have any protein in it. You can make your own smooth foods, and in your handbook, there's a section on how to prepare these foods. Your portion size may be gradually increasing somewhere to 2 to 4 tablespoons per meal. Again, these are guidelines. Don't push it. Remember to chew. Always choose your protein foods first, and at this point, it's important that you start taking your vitamin supplementation. It is important that you start taking your vitamin and mineral supplementation 1 week after surgery. Please take these with food because you'll have better absorption. They do need to be chewable or liquid supplements so you get the best absorption. In your packet that you'll receive at your visit with the surgeon, there is a guideline on what to take when. You will be taking a multivitamin, a B complex, calcium. We will be doing a lot of blood work that first year to check your iron and your vitamin D levels, and we will be tweaking your supplementation as needed. Your last 2 weeks of your first month out after surgery are on soft foods. And soft foods are described as anything that you can mash up with a fork. So if you're going to be doing meats, because remember you're doing your protein first, please choose ground meats, ground turkey, ground chicken, ground beef. Fish works well because it's easily mashed with a fork. Your vegetables will have to be soft cooked, probably more so than you're accustomed to eating them because they do need to be soft. Your portion sizes are increasing, 1/4 to 1/2 cup. Again, these are guidelines. Be sure to chew everything thoroughly, cutting it up into pieces the size of the end of your little finger and chewing everything 20 to 30 times per bite. Exercise or physical activity is critical for long-term success, and this is a part of changing your lifestyle. We all need to look for ways to move more just in our daily activities. The goals from the American Society of Metabolic and Bariatric Surgery is to be doing 150 minutes a week up to 300 minutes a week of cardio, plus the 2 to 3 days of strength training. The strength training is critical because you want to lose fat. You do not want to lose muscle mass. Everybody can do something, and everybody's got to do something. Remember, this is a lifestyle change. This is not a diet. We're changing eating habits and exercise habits. Your first 90 days after surgery are called your global period, and all of your office and visits are included in your surgical fees. If you want to come in and make an appointment with me during that time, you just need to call scheduling. You don't have to be having problems. A lot of times I have people who come in just because they want to see what they're doing, ways to increase their protein, looking at their portion sizes, and just making sure that they're on track. Remember to look at the food labels. If you don't have a food label, you can look up products online. You want to watch that fat and sugar because you want to prevent dumping syndrome. It's an unpleasant experience and it's not something you want. Please don't be jumping on and off the scale every day, weighing yourself. This can be very frustrating. You're going to have plateaus just like you did before surgery. You will lose weight when you follow the guidelines. If you have trouble staying off the scale, put it in the trunk of your car. And also in your packet, you will have a restaurant card. Carry this with you so when you go out to eat, you can show this at the restaurant and order off the senior menu, maybe a child's portion size, or ask for reduced portion sizes. These are the 10 important rules that we ask you to follow. They will help you keep your weight off long term. Number 1, remember to eat 5 to 6 times a day. Your pouch doesn't hold very much, so you need to be eating more often to keep your blood sugar stable. Number 2, eating only at planned meal times. This is not grazing. Grazing is that nibbling business that goes on all day long and leads to weight regain. Number 3, eat good quality foods. Eat your protein first, eat your fruits and vegetables second, and eat healthy carbs if you have room. Number 4, eat slowly. You want to chew everything 20 to 30 times per bite. It's going to take you a while to eat your meal. Should take you to 20 to 30 minutes to eat your meal. One of the things that happens is when your food is sitting for 20 to 30 minutes, it gets cold and then it might not be as appetizing as when you started. A suggestion that you might want to use is going to a store and get one of those coffee mug warmers. You can plug it in, put your plate on it, and it will keep your plate hot while you're eating, and so your food will still taste good. Number 5, remember to stop eating when you are no longer hungry. You do not want to be full. Full is too much food, and full is uncomfortable. Number 6, keep your portion sizes small, somewhere between 1/2 and 1 cup, or about the size of your fist. This is long term. Number 7, no beverages while you're eating. You can drink up until mealtime. Stop drinking any beverages while you're eating, and then please wait 30 minutes after you're done. Number 8, drinking low-calorie, non-carbonated beverages between meals. Number 9, getting in your physical activity. And number 10, take your supplements daily, every day, for the rest of your life. Thank you for choosing WBI. We wish you well on your weight loss surgery journey, and we look forward to working with you in your post-op years.